Welcome back, everyone. In honor of Alzheimer's Awareness Month, our next guest is here with some vital information regarding our brain health. Please welcome to our home functional medicine expert, Dr. Elroy Vojdani. Welcome, Dr. V.
Thank you so much.
Yeah, thanks for being here.
Thanks for having me. I really appreciate it.
This is really critical information for all of us and everyone watching. Where there are almost 6 million Americans living with Alzheimer's today, and that number keeps growing pretty rapidly. Yet this is one of the most hard diseases to diagnose. Why is that?
Yeah, unfortunately, we are facing an exponential rise in Alzheimer's in the next 20, 30 years. More concerning than the 6 million that have Alzheimer's right now, there are 46 million Americans who have preclinical Alzheimer's.
Oh boy.
That means that they are on the road to getting Alzheimer's and they don't know it yet. The difficulty that we have is that we really don't, I know it's an incredible stat.
Well, it is an incredible stat considering there's 6 million with it and there's 40, would you say 47?
46.
46 million on the way.
On the way.
That doesn't even it's not even
Well, we know the disease has a 10 to 15-year silent window. So this process is going on in people's brains and they have absolutely no idea. And when symptoms of progressive short-term memory loss appear, it's almost too late at that point. And that's when someone gets a diagnosis. That's the real difficulty
Oh,
here.
that's why, because you have to wait for that to happen before you can actually say, oh, this is what it is.
Exactly.
Well, let's talk about those then, in particular the signs and symptoms of early onset Alzheimer's. Go ahead.
Yeah, the major signs are, again, the short-term progressive memory loss. So those are things like forgetting people's names. You see someone at a party, you should know who they are. You can't for the life of you remember their name. You need a reminder. And that keeps on happening and that it keeps getting worse over time. People also start to lose something called executive functions. So those are higher functions of the brain, being able to balance a checkbook. And if you're still working, you know, that's where some of those things really start to show. You can't keep up with your daily tasks at work. Your boss or the people that you're working with are starting to ask questions, and you know, it can be really debilitating to someone's life.
Okay. Well, now, thankfully, there have been some breakthroughs. There's a blood test that any one of us can take that will help detect whether you may be getting Alzheimer's in the future. It can also help slow the progression because you'll know what you need to do to maybe slow it down a little bit, and that is called Alzheimer's links. And you actually had a hand in creating this. Tell us about this. This is groundbreaking.
Yeah, it's really, really a very exciting time finally in the world of Alzheimer's. I think the big point here is we need tools as a physician to be able to identify who's in that 10 or 15-year silent window. We can't wait until they're at full-blown Alzheimer's disease. The earlier we intervene, the earlier we can catch these people, the better off we are. So this test was the end of a lot of research that our lab performed, looking at all the different markers that can give us a good picture of who might be on that road and who isn't.
Okay.
And along with our own research, there are several other labs that are looking at how we can do blood testing to identify people in that silent window, hopefully catching them 10 years before and doing something to reduce their risk in the future.
So what does this blood test check? How can you just take blood and you say, okay, it has this or that? What are the markers?
The panel that I did the research for that got developed looks at actually more than 20 markers. We're looking at abnormal brain proteins associated with Alzheimer's disease. We're looking at the integrity of the support systems of the brain, something called the blood-brain barrier, and then different environmental factors that we found in our research can contribute to Alzheimer's are all on the panel as well.
Okay.
I was really shocked when we were reading the research that only 1% of Alzheimer's, correct me if I'm wrong, you're the doctor, is genetic? Only 1%?
Yeah, so there are really two big camps with Alzheimer's. There's early onset, that's entirely genetic. That's 1% of the entire group. Those are people who are going to present in their 50s typically, and unfortunately there's not much that can be done right now for those people. The 99% group is a combination between the environment and genetics.
Okay. Wow.
It's
staggering numbers for sure. Okay, so whether or not we've been diagnosed with early onset Alzheimer's, there's things that we can do, people, whether you've been diagnosed or not, we should be doing it anyway. So what are they?
Absolutely. This is the biggest takeaway point, I think, from this entire thing.
Excellent.
We need to lose the idea that you are doomed or destined to get this disease if you're on this road. We know from several studies, one of them just published by Dr. Isaacson at Cornell, that if you catch this early enough and you do something about your life, you can reduce your risk of getting this disease. So the basics, right? Eating a certain diet, sleeping well, exercising, socializing, using your brain.
Let's get specific with
Yeah,
what type.
what do you
So
mean
eating a
diet?
certain diet, what kind?
The Mediterranean diet has the most evidence behind it. So, you know, Our brain is 60% fat, believe it or not.
Yeah.
So we need healthy fats in the diet. Those are fats that come from fish, fats that come from avocado, fats that come from olive oil, delicious things, right?
I'm a big proponent of that. So
I wrote a book about it.
Yeah, exactly.
My cookbook is the Mediterranean
I mean, I
diet,
thought
yeah.
Debbie was going to get up and do like a Greek dance or something when you said that. Yeah.
But it's basic. It's common sense, kind of.
Yeah.
And probably also trying to eliminate any toxins that are in our environment as much as we possibly can.
Absolutely. I preach to all of my patients, you need to clean up your world as much as you possibly can.
And that is a lot of aluminum, I know, is an issue.
Yeah, we advise, part of the things that we found in our research, that aluminum is potentially a big concern. So I tell everybody, do not cook in aluminum containers, do not cook with aluminum foil. Anything that has been stored in aluminum for a long period of time, avoid.
And sleep, which is difficult, I think, for most Americans out there. How much sleep do you recommend?
7 hours of ideally uninterrupted sleep. I have a 14-month-old, so I can completely, I connect with people who are not having the best sleep in the world. But yeah, we need 7 hours. The data is actually very clear. This is the #1 thing over the course of your life that matters for your risk of getting Alzheimer's in the future.
Well, Doc, during the commercial break, I think I'm going to take a nap.
Yeah.
Thank you so
Uninterrupted,
much.
Thank you so much. Thank you.
Only for
very
2
much.
minutes or so. For more invaluable information from Dr. V, visit regeneramedical.com.